Hello, this is Umer Registered Nurse. Today I'm going to discuss about first line, second line and third line therapy for the type 2 diabetes. Before we learn about the therapy, we need to know what is type 2 diabetes. Type 2 diabetes is a chronic condition characterized by insulin resistance and impaired insulin secretion. So your primary care provider has to diagnose your type 2 diabetes. They need to do some lab work like hemoglobin A1C and then fasting blood glucose. If the hemoglobin A1C more than 6.5, maybe primary care provider will give you some medications and lifetime modifications. So managing this condition requires a structured approach involving pharmacological therapy. Type 2 diabetes is typically stratified into first line, second line, and third line treatments. Understanding these therapeutic strategies and their contraindication and the necessary monitoring is vital for effective patient management. So, first line therapy for the type 2 diabetes is the lifestyle modification and starting with biguanides, which is metformin. We all know metformin. Metformin is a favored due to its efficacy in lowering blood glucose level and favorable side effect. Metformin differs from the traditional oral hypoglycemia, for example, sulfonylureas, in that it does not stimulate endogenous insulin secretion. Instead, drugs of this class enhance tissue responsiveness to insulin. Sulfonylureas can cause hypoglycemia easily and are contraindicated in patients with significant hepatic impairment. The most common side effect for the metformin therapy is dose-related GI upset, such as nausea, diarrhea, bloating, abdominal discomfort. However, it is contraindicated in the patient with severe renal impairment due to the risks of lactic acidosis. Especially patient who has severe kidney impairment, estimated GFR rate below 30, patients on metformin require regular monitoring of renal function to prevent potential complication. They can do like every 3 months the renal function test and then monitor renal functions. When metformin alone is not sufficient, second line therapy needs to be initiated. These include medication like sulfonylureas. We already discussed about it, how it makes you easily hypoglycemic and it's bad for the hepatic impairment. And also DDP4 inhibitors, GLP-1 receptor agonist, and SGLT2 inhibitors. Each class of the medication has specific benefits and contraindications. The anti-diabetic medication class that promotes weight loss is GLP-1 receptor agonist, which mimic a natural hormone to increase fullness, slow digestion, and reduce appetite. Some examples include like Ozempic, everyone using nowadays to lose their weight. And also GLP receptors agonists are contraindicated in patients with who has history of medullary thyroid carcinoma. Regular monitoring of blood glucose level and renal function is essential for these medications to ensure safety and efficacy. Other classes like SGLT inhibitors may also lead to modest weight loss. Example of SGLT2 inhibitors include canagliflozin, Farxiga, and then Jardiance, and so on. Common side effect for SGLT2 inhibitors including dehydration, yeast infection, and increased urination. Basically, the sugar is going to remove by the urine, so that's why yeast infection is more prone to for the SGLT2. Finally, third line therapies are considered when previous treatment do not achieve desirable glycemic control. Insulin therapy is commonly employed at this stage. Insulin requires careful titration and monitoring of blood glucose level to avoid hypoglycemia. Moreover, patients should be educated on recognizing the sign of hypoglycemia and instructed on proper injection techniques. Insulin management for the diabetes in primary care involves starting with basal insulin, which is long-acting, adjusting it based on blood glucose targets, and intensifying therapy if needed. A thorough patient assessment, include their lifestyle and motivation, is important before beginning treatment. Patient must be educated on insulin administration, blood glucose monitoring, and hypoglycemia treatment. So we know that basal insulin, also known as background or long-acting insulin, is a type of insulin therapy desired to provide a steady, continuous supplies of insulin throughout the day and night. It mimics the normal low-level insulin secretion of healthy pancreas during period of fasting, such as between meal and while sleeping. In conclusion, I would like to say the management of type 2 diabetes involves a progressive approach of beginning with lifestyle change and metformin, advancing to the additional oral agent or injectables, and potentially leading to insulin therapy. Awareness of contraindication and diligent monitoring of patients are essential components of effective diabetic management, ensuring that therapy are both safe and beneficial. Adhering to the guidance can optimize patient outcomes and help to reduce complications associated with type 2 diabetes. So basically the main goal is to maintain healthy blood glucose level to save patient's organ. That's about the treatment plan. And then definitely all the treatments has a side effect of the hypoglycemia too. So patient needs to be aware how to manage hypoglycemia and how to what is the sign and symptoms of the hypoglycemia. Next time I'll bring up with the sign and symptoms of hypoglycemia. Thank you. Bye bye for now.